My name's Matt Roberts. I'm a foot and ankle orthopedic surgeon at the Hospital for Special Surgery. I see patients that have injuries to their foot or ankle, patients that have pain or deformities in their foot and ankle. We treat ankle fractures, Achilles ruptures, metatarsal fractures, toe fractures. We treat flat foot deformities, bunions, hammer toes, high arched feet, tendon problems, ankle cartilage problems, ankle instability. The people that are at risk for ankle fractures are basically anybody that is active on this planet. I think that they can be subtle and as simple as stepping off a sidewalk or into a pothole, or more obvious like something on the field, like being a slide tackle or sliding into second base. But I think people that have osteoporosis or might have bone conditions that make their bone a little weaker are obviously going to fracture a little easier than a 14-year-old doing the same activity. Arthritis doesn't increase the risk of ankle fractures, but having your ankle fracture managed inappropriately can lead to arthritis. Obviously, what we're trying to do is mitigate any progression of instability which may lead to arthritis, and that's why it's important to have your ankle fracture evaluated properly. The goal of what we're trying to do for you is to figure out what is the best procedure to address your problem. And it may not be a fancy plate or screw, but it's having the right indication for what your problem is. So I think that each problem is different. I think foot and ankle is exciting because there are so many different things that we treat that it's not one size fits all. I think that you need to treat each patient individually and tailor your care to their problem. When patients are happy, that's ultimately what makes us happy. I think that when patients come back or write you a letter that they're doing well or send you a picture of them doing an activity, that reminds us why we do what we do.